Hello, everyone, and a warm welcome to episode 29 of our Decoding in Healthcare series. I'm your host Etwisha, and I'm very thrilled to have our hosts with us today. Joining us is Dr. Amit Kumar Dey, a renowned physician, diabetologist, and AI entrepreneur. Dr. Amit is the visionary behind Doctors AI India, and he's been leading conversations on how AI can revolutionize healthcare. And today's episode is even more special because we are diving into a newly released book, Digital Health, written by none other than Dr. Dipu. Dr. Dipu is a digital health consultant and AI entrepreneur based in the USA. She brings a wealth of knowledge on how digital transformation and AI can improve patient care, accessibility, and outcomes. Thank you both of you all for joining us, and it is a pleasure to have you.
Thank you very much. Hi, Dipu.
Hi, Amit. How are you? It's so good to see you. Happy Diwali week to everybody in our audience. I'm so excited to launch this book and excited to talk about it and share it with everyone.
Yeah, guys, a warm welcome to this episode of our podcast. Thank you, Hetvi, for the introduction. It's been a journey on this podcast, and we've been highlighting so many things over the last 1 year. And this one is very special to especially to Dipu as well as to me. And we thought that what's better an opportunity than to discuss a book which Dipu has published, and I have been I've been lucky enough to participate with a chapter in this book. And throughout this episode, we're going to talk about this book, Digital Health, Telemedicine, and Beyond. Dipu, can you just give us an overview, a glimpse of what you just published?
So, I'm very excited. This has been a labor of love for me for the last, I would say, 18, 19 months. I want to start off by thanking every single contributor who has contributed to this text. 35 wonderful in-depth chapters that really takes a deep dive into what digital health is and is going to be in the future and how it's going to impact patient outcomes. So we have everything from the beginning of AI and digital health and everything between. And, I hope that people find, I intentionally titled it Telemedicine and Beyond because, and I came up with this concept, telemedicine was the buzzword and was starting to come into our practice and into our daily lives just post-pandemic, right? And I was starting to think about, well, what's next? We have now kind of broken the gates and the fear of telemedicine and the practice of it and the adoption of it. What are we going to do next? And that kind of started me thinking on this journey of crafting this book. It was a happy circumstance, happy coincidence that OpenAI launched during this period while we were writing, and it really did help us shift our mindset. And so the chapters run from the beginning of like the basics of AI and within the healthcare context and how it's going to implicate our care plans all the way through organizational adoption and how do you think about that at your organizations. And then a couple of things I want to highlight that I'm really proud of, in addition to all the contributors, is I have some special contributors which were students who are currently in PA school and pursuing their doctorate. And so their capstone presentations, their thesis that they were writing, 4 of the students, 2 of them were partners, and then 2 additional chapters for 3 total chapters were written by students who are currently in PA school, either pursuing their master's or their doctorate. And so I'm immensely proud of that particular fact. And then also I didn't forget the patients. The book closes with a chapter from the patient perspective. And so Deborah Rue contributed to it and really is an advocate for the populations that are not seen as much, and how digital health is going to help with accessibility in these populations. So there's something for everyone in this book. And of course, I'm so happy to have you as a contributor in this book. And you and I collaborated on a chapter on digital health and the future of preventive care. Do you want to dive into what you kind of learned and what we've offered in this chapter?
Yeah, and I think the whole book, as I have gone through it, and while you were preparing it, I totally acknowledge all the hard work that must have gone in editing and collaborating with all the authors. To all our viewers out there, before we dive into this context of preventive health and the role of digital health in preventive care and primary care, I think over the last probably 5 or 6 years, we have seen this concept of digital therapeutics, digital health evolve. And as we stand today, at the brink of artificial intelligence coming into healthcare in a big way, we are literally in a digital health ecosystem. And when I talk about this digital health ecosystem, Dipu, it starts with the patient right at the center, and the data PowerPoints being their wearables and the sensors, and all feeding into the big cloud, the data getting assessed. Somewhere there is telemedicine that is always playing a very mitigated integral role in connecting the healthcare provider with the patient at the right point. And now, the most interesting and the most exciting part is the introduction of artificial intelligence into this digital health ecosystem with a layer of natural language processing that makes this whole experience, this whole interaction, much more user friendly, much more superior. And probably this will make this ecosystem survive in a more successful way. And at this context, this book, Digital Health, Telemedicine, and Beyond, so now we can understand what the beyond means, is a need of the hour. Now, coming back to the chapter, I think you had given me a fantastic opportunity to speak about my thoughts of how chronic preventive diseases can very easily be addressed with the help of technology. And especially being a doctor practicing in India for the last 15 years or so, I have personally experienced that connectivity, logistics, accessibility to the care, even affordability and availability of the right care at the right time becomes a big limitation in providing the best of care or in getting the best of care if I am a patient. And I feel digital health solutions using telemedicine or even other forms of digital therapeutics can come a long way in solving this solution. And I think our chapter focuses specifically on that, how these preventive diseases can actually be prevented or intervened in the right time, with the right point of care by the right caregiver. And I think this is the key element that will make this digital health ecosystem work in preventive disease.
Absolutely. And I think you highlight in that chapter, because one of the tasks that we wanted to convey in that chapter is, okay, we can talk about it, but how do we put it into practice, right? Like how do we, and I think you used the diabetes as a chronic disease as an example to highlight all these digital touch points that still keep the patient at the center of every aspect of this digital journey for our patients. It's obvious to all of us who live and breathe in this space that healthcare is changing. I think it's changing for the better, although
and
it will
fast.
take
It's
time
changing very
and fast. Yeah, and I think it'll take a little bit of time for full scale adoption. But I think the pieces of adoption that are happening now in a meaningful manner, and the things that you're doing that you highlight in this chapter are so helpful to provide some context for those who are just starting to explore this field through the digital lens. And so, I think preventive care is one of those things that we kind of think of it as this beast that is really difficult to tackle in one foray, because everyone brings every patient is a little different. But I think the tools that you highlight, and I'd love to hear some of the tools that we highlight in that chapter from you, in the context of diabetes, and how they really do improve, not only impact, but improve patients' lives, because it also brings us as providers a little bit of peace of mind that they are taken care of, even though we're not there to guide them. right? And I think that's what these tools do. So if you wouldn't mind kind of sharing an example that we've written in the chapter.
So I think in chronic diseases, again, from all my learnings and experience of these years of practice, the biggest factor that counts is the support that the patient is getting beyond the clinic time. We often get 10 minutes, 15 minutes, 20 minutes max to connect with the patient. And then you get to connect with the patient after, say, 3 months, 4 months. In cases where the logistics are difficult, it is even 6 months or even longer if the patient is not compliant. And that's not what you want in managing a chronic disease like diabetes, because you know the control is so important with the regular follow-ups. So digital health is what comes in when the patient walks out of your clinic till the patient comes back to your clinic in the next visit. That connectivity with the patient and all-time connectivity of the patient with the doctor kind of increases the confidence in the treatment and the caregiver. It also increases the compliance to the treatment that has been offered. Now, of course, in the context of diabetes and metabolic care, we are already having connected devices, connected glucometers. You have the connected continuous glucose monitoring systems, which can all feed in the data through the digital health ecosystem into the cloud. And the doctor can monitor this sitting at his clinic from the dashboard. And you have the telemedicine, which platforms now, which can also enable the doctor to connect with the patient. And as I always say, in chronic care, it's not that the patient is going to seek care from us, but it's us who's going to reach out with the care to the patient. So this initiation of care from the healthcare provider to the patient, and not the other way around, that the patient is coming for a sick care, I think is very important in chronic medicine. And this is what digital health is going to bring. So, for example, you have a patient that is having a lot of fluctuations in the glycemic parameters, and the things are not working out. Instead of the patient really finding that out and reaching out to you, if you are connected to the blood glucose readings of the patient, you could reach out to the patient and intervene. Just in time, timely intervention could actually improve the outcome that the patient is going to get in 5 years, 10 years, and 15 years of this chronic progressive disease. And then you layer it with generative AI, that is now the talk of the hour. You add a layer of natural language processing in some validated chatbots, certain kind of chatbots that even we have built at Drs AI with the help of our colleagues. We have come up with a chatbot called Madhu AI that has been validated by doctors, about 100 doctors in India. And now this is available in all languages. It's just a WhatsApp user interface chatbot that any individual can use to ask diabetes and metabolic health related questions. And it is just available in all languages for that individual to ask. So the point I'm trying to make here, Dipu, is digital healthcare starts, the patient walks out of your clinic and till the patient comes back. And all those data point inputs that you get are that thick layer of the iceberg that we have been missing so far. So as we say, tech and AI helps you see what you have actually been missing. So I think digital health is actually going to transform the way we deliver diabetes care or care, metabolic care, or care of any chronic disease for that matter.
Absolutely. Yeah. And I would say, like, to your point, if I could put a finer point on that the care starts when they leave the clinic. Yeah. This untethering of care from the four walls of our office, right? This untethering of that care and saying care can be available to you whenever. And the reversal of the patient, rather than the patient coming to you going to the patient at any point. And up until now, we have been talking, at least in these spaces, we talked about preventing that hyper or hypoglycemic event. But now we're going beyond that. We're actually not, that's actually just the norm. Like, we expect these systems and digital tools to do this. Now we're making those micro adjustments to patients'
precision
lifestyle.
Care.
Yeah,
precision
exactly.
Care. That's what it is.
Yeah, to impact them 5 years down the line, to delay the onset of diabetic complications like retinopathy and all of these kinds of things at the end. And so we're at the very beginning of this era, and that's what makes this book very, very exciting, and I think a must-have for every bookshelf who are in healthcare providers, whether you're a practicing clinician or an educator. And by the way, the book covers everything from how do you incorporate it into the classroom, so the medical students who are out there should have it, and the faculty should have it, all the way through how is clinical trial design going to change. And what are some best practices on how to use AI in the classroom and then beyond at an organizational level? So we've covered every gamut of that journey for you from beginning to end as in your training and your lifelong learning as a healthcare provider. And
I mean, that is.
Yeah, go ahead.
Yeah, I mean, that is just amazing. The spectrum that you just covered in the book, and I was about to ask you this: that even while we are so highly appreciating the potential that digital health ecosystem holds, we are still faced by lack of literacy towards the digital health and the acceptance. And I would say this is in both ends of the spectrum. It's amongst the clinician as well as the caregivers and the care seekers. And I'm really glad that you took the effort in bringing out this book that covers all the spectrum, whether it's a medical student trying to get a medical education, or whether it's the use of digital health in hospital administration or by the overall healthcare workforce, or it's in a specific disease, or for assisted services in cases of disabilities. So you have covered this whole spectrum. So tell us, Dipu, and tell our audience how much this book is going to actually help solve this digital literacy problem in the larger population group of the healthcare providers and beyond.
I think it will make a pretty big dent actually in the literacy piece. And I will say, as an educator myself, I approached this book and I asked all the contributors to approach writing their respective chapters with the end in mind. And most of the chapters will have what I've called assessment, meaning if you wanted to, let's say, assign a chapter in a course that you were teaching to your students, they could read that, and then there are sample assignments and assessments that you could give to your students to say, okay, now I want you to do this assignment based on this chapter, or here's some more resources that you can use to build your knowledge on this particular chapter. And so, not all of them have it, but most of them will have some sort of like, let's learn this even further, so that you're getting the basics of literacy, whether it's AI, digital health, generative AI, whatever it may be, including definitions and things like that. But then you also have the ability to say, okay, now I have a good foundation after reading this particular chapter. I want to learn more. And how do I go about doing that? And as a faculty, you have the ability to assign students work based on a particular chapter. And you don't have to read them in order to glean the information that you need, right? You can pick and choose. And if, there's everything from CMS regulations to FDA regulatory work, there's digital therapeutics, and everything in between. The point I was going to make before was, this is truly a book for a global audience. It was written by global contributors, right? Like yourself, we have people from the EU who have contributed in the UK.
That's fantastic.
We have physicians, we have MDs, we have, Dr. Harvey Castro, Dr. GPT himself contributed a chapter. So there's a lot of knowledge that is in this book that everyone will have something to take away from. We have FDA. We have a chapter dedicated on the regulatory area specific to the FDA, so that if you're an entrepreneur and you want to learn the basics of it, there's a chapter in it for you if you're thinking of
fantastic.
Something. So
all in all, it's a fantastic combination, and I think it's a must read for doctors, healthcare providers who are just starting with AI and technology. If you're naive to the concept of what's really happening around me and how do I really get myself started with this foundation knowledge, because that was a kind of a glimpse that I got after reading the author's copy of the book, that it's a fantastic resource for gathering foundation knowledge. And especially, like you said, you've covered the whole spectrum of the chapter. And we've also touched, what I liked about the book is that, as you rightly named it, it's and then beyond. And at every point you have touched upon the opportunity that a particular segment has to evolve with the use of AI or generative AI amalgamated with the existing technologies that is already being in place. But again, having said that, there are many instances that I saw in the book where you just not talk about these futuristic tools, you talk about some real world applications. So, I mean, I don't want you to give the whole book away to our readers in this podcast so that they have the curiosity to go out, buy it, and read it.
Yeah.
But you want to give them a couple of glimpses as to what's really happening that really makes things very promising?
Yeah, sure. I mean, I think some things are going to be very obvious to our listeners. Things like remote patient monitoring, which we are now using more and more, and has become the norm for a lot of us. But I think what we're going to see is the further integration of AI into clinical workflows. So you have this tool, you're thinking about using it. And really, the thought process is going to be, where is it best integrated? Because you're not going to just, plug it wherever you kind of feel like it, right? It has to work within your practice. And that is one thing that I think a lot of clinicians think that, like, we're going to have this one more thing for us to kind of do. But the reality is that it has to work for your workflow. If it doesn't work for your workflow, then it's not going to work because you won't use it. And I think that is the part where, so examples of this, to me right now, front and center are areas such as disabilities, where we can use AI tools to help patients see for the first time or navigate their world with audio cues that they couldn't have navigated in the past. And the tools are now, it's not that the tools didn't exist, but they weren't portable enough or accessible enough for them to use. And that's what these platforms and these tools are doing and enabling our patients to do. I think it was in a recent Drs AI office hours where I had mentioned that I think digital health is really going to change the way we view disabilities in the future. And I think it has, and it will continue to do so, because it's not, somebody who cannot see or cannot hear today is going to have the option to do both those things in their own way in the future. And so this is the most promising part, and I'm most excited about. Yes, I'm excited about our day-to-day patient care and the tools that we're going to use with algorithms being infused in our clinical decision making, but also the impact that it's going to have on those lives that we don't see every day and are going to be touched in a greater way.
I think this really highlights the promising potential that technology can bring if it is introduced in the right time, with the right intent, and with the right power, or I would say with the right fuel in it. So I think transforming the way we treat disabilities is a magical thing, something that we could not imagine even 15, 20 years back, that this would be possible with the help of technology. You're really making such a great impact in the life of an individual. And
that's right.
It is something that we have read. It's the quality of life. It's their regular quality of life, or the indexes, it really improves when they're using these technologies. And it's only fascinating to even think how these technologies are going to evolve now, with so much of data input coming in, with so much of AI being harnessed around it. It can only go from the good to the better and the best. And the biggest takeaway that I feel that's come out of by reading this book that you have published is it has always kept the patient at the center. The whole context of the book was patient centricity, reaching out with the best of care for the patient that they need at that point of time. It doesn't really need to be the idealistic care, because sometimes we are so taken away by guidelines and we are so taken away by norms that we tend to individualize the care in the best interest of the patient. So that's what the book focuses on: more personalized care, more precision care, and keeping patient in the center. And I think this has been a big take point where you've really stressed on shared decision making between, in any case, by a healthcare provider and the patient. So what are your really views on this? And more importantly, Deepu, as a person who has been educating the next generation, how do you really see this approach to patient care changing from more hospital centric or clinic centric to a more patient centric care using digital health technology?
Using digital, I'm reminded. I often tell our folks when I'm discussing digital health is that in many ways, digital health is allowing us to return to the old ways of practicing medicine, which is before my time, before your time. The doctor came to you to see you at home, right? The care you got was in your home. And it wasn't
the doctor
until
will see you now. So it's the patient
the
will
doctor will see you now, right?
now.
Yeah, exactly, right. The patient will see you now, right? And then it wasn't until hospitals kind of became the thing as part of modern medicine and became where then the patients had to go to the doctor, right? Digital health now is, again, untethering that and bringing that relationship full cycle to now the doctor will see you now in your home, but through a screen or through a tool. And by the way, without the compromise in the quality of care delivered.
Yes.
And that's a huge piece of this, because if these tools weren't good enough to take care of patients, we would not be using them and we would not be advocating for them as healthcare professionals. And so this full circle that we've come, which is why in many ways I am seeing more adoption of these tools by patients than I am by clinicians at this point. Oftentimes, it's the patient that comes to me and says, "Hey, I'm using this. It's pretty cool.
Yes.
Do you know about it? And so I think the patients want that, and it automatically allows them to be part of that shared decision making process that you were talking about. And I think the more we can get patients excited about these tools that will impact their lifestyle, the better, and dare I say easier, our jobs will be in some regard, right? Not that we're looking for easy, but if we are able to make an impact on glucose levels or weight loss or smoking cessation, all of these things have long-term implications for the better for the patient and then for society as a whole. So, in the first chapter that chapter 1 that I've written, I actually closed the chapter with 10 statistics, looking at it from a global level, 10 statistics that I ask everyone to kind of think about as they are reading the next chapters within the book. And I'm not going to share all 10, but I'm going to share some stats with you from that table, and have people think about how these tools are going to impact them in their practice, and then ask educators to think about how am I going to shift how I educate the next generation of students on these tools. So the first fact is the global population is expected to reach 8.6 billion by 2030 and 9.8 billion by 2050. Mm-hmm. And by the way, some of these, I intentionally chose dates not so far in the future, where these are, I think, in our lifetimes, these things are going to happen. And so we want to be able to be making an impact, right? The second fact is the WHO projects a shortage of 15 million healthcare workers by 2030. These tools can only enhance our ability to have the outreach and the ability to care for the population that we're going to have before us if we leverage them for ourselves. It may actually help us make a dent in the shortage, right? So 15 million is a lot of healthcare workers on a global level. And then the third fact is by 2025, we're already on the cusp of it, right? Global healthcare data is predicted to exceed 10 zettabytes, which equals 10 trillion gigabytes. And secondary data mining and analytics will aid in improving research.
Yeah.
That is an insane statistic, right?
I think these are insane statistics, but that actually brings me to another thought in the flow of our discussion today. Well, from the patient side, I feel the adoption of a digital health tool, and this is a takeaway for all our listeners who are entrepreneurs, startups, bootstrapping companies trying to really work hard in making a difference in healthcare by developing a digital tool that addresses the need gap. For a patient, it's the comfort, it's the user friendliness, and it's the increased connectivity that the digital tool ensures with their trusted healthcare provider. I think this is the three important key factors. It's their comfort, it's the user interface. I always keep saying the simplest of user interface succeeds the best in the acceptance by the user, because they don't want a very cluttered tool, they don't want a very complex tool, they want something which is very simple to use, something like WhatsApp, which has been going, going like a blast messenger all over across the globe. It's just because of the simplicity with which you can use it. So this is a very important need of the hour. But there lies a very important layer of concern here. You just mentioned the statistics about the huge data that is there, that is getting created from everything that I enter, the patient enters, and all the inputs that comes in from the wearables and the sensor. And the question that lies in the mind of every individual, whether it's a healthcare provider or somebody in this healthcare workforce somewhere who is trying to incorporate a digital health tool into the ecosystem, or even it's the end user, which is a doctor or a patient, is it really safe? Is my data private? Do I really have the assured security of anonymity on the data that I'm sharing? Who is getting to view this data? Where is this going? How can this data be later utilized? Well, for research for the good of mankind, well, can it be utilized in any other way? And I feel this becomes a big step limiting factor, Deepu, especially to doctors and clinicians who are not fully confident with digital health literacy, and that limits them in adoption of this digital health technology into their day-to-day practice. Although they see that yes, it's making a difference, it's bringing an outcome in patients using a digital tool and those not using a digital tool, too, I'm still shy to use it because I'm very skeptical about the data privacy, the data safety, the data ownership. And even as we speak here, I remember, this was a topic that we brought it up in the first podcast. This is a topic that comes up somewhere in our every podcast. We are 1 year down the line. We still don't have those clear-cut answers. We had guidelines floated here and there in the EU Act and by the FDA's, some guidelines being floated out by the WHO, and some I would say flimsy sort of thought process flow coming in from our Indian guidelines as well. But we still don't have something concrete that is globally accepted, globally applied, that can bind the things, yet not bind it too tight, but give that freedom of data sharing. The data interoperability is a lot in question, and these are always going to be a big step limiting factor. So I'm sure these are going to be a points which has definitely been mentioned somewhere down the line book, and the readers are going to find it very, very intriguing and exciting to just get a feel of how these factors are going to influence. I'm sure none of us can give full answer to it, where it stays and how it's going. We cannot give you a clear-cut answer, but I really, really hope that, down the line, we will be getting more answers to it. And at the end of the day, as end users, I find myself more confident in using a digital tool because I'm assured about the data privacy, the data security. So what are your thoughts, and what are we expecting from the book on this?
Yeah, there's definitely a couple of chapters on fair use of AI and the ethics around it. I think the answer is we don't know, and it's still evolving. I think we all grapple with AI ethics especially in healthcare. And I do think it's worthy of many classroom debates and discussions as we frameworks by the EU, the US, India also is trying to put together. None of them are perfect, I don't think, but I think all of them require in-depth inquiry and debate so that we continue to evolve our understanding of what these tools can and cannot do in this moment, by the way, because as these tools evolve, our AI and fair use ethics laws are going to also have to evolve. The question is, how do we create that framework? And the answer very well may be a existing tool like blockchain, for example, where it is secure, it is able to kind of cross the limitations of infrastructure barriers that we currently have. And so the answer is, I don't know what the answer is, but I would encourage everyone to continue to ask the questions that you asked, right? Is it safe? Is it secure? Is it where is it going? Who is using it? Who has access to it? All of these things are still very, very important. And I would ask everyone to continue to ask the questions and push back on any tools that don't give you a satisfactory answer. So don't implement tools that are not secure or safe in your use, in your particular use case that you have. So it's, we have an AI ethicist who has written the chapter on AI on this from Carnegie Mellon. So we're very excited to have his contributions on this. He's a professor there. And so you're going to learn quite a bit of all the angles, all the prisms of this particular issue. And I'll just say that the digital health ecosystem is evolving. You know, when we started with the digital health wasn't a term that was really used very often 5, 6, 7 years ago. And what falls under the umbrella of digital health now is growing. You know, we had EHRs, we had apps, we had telemedicine, but now we have AI, specifically generative AI. We have so many mobile health apps, remote patient monitoring, all of these things that are now falling under this umbrella of digital health and enabling us to evolve. And that's what I find particularly exciting about this field, and which was one of the passions that kind of led me to proposing this book to Elsevier and Academic Press, because I think this brings forward issues. It's not a here's how you do it. It's here's what you should be thinking about as you go forward. You know,
I think this is very well put by you, Dipu, that this is something that is going to be the digital health rules. I would say, if I can really quote the word rules, the regulations, the privacy factor, the data ownership question. I think these questions will be better answered when healthcare providers, mostly who are the end users, the healthcare providers, and of course the patients, when they come up with more and more digital literacy. I think this literacy is the key, because
literacy piece is key.
Yes, because once we are literate about how this whole framework is going to work, I think we will be probably more equipped in finding a more regulatory answer than what exists at the moment. And I think this has been the whole thought and the whole vision and mission behind what we have built, and with support like international wing leaders like you, the community of the Doctors AI that we just had. I think we started this in December 2023, and now we have over 2,000 doctors connected with us globally through social media connects, whether it's WhatsApp or LinkedIn. And I think this is the start in which we need to make ourselves more and more literate about digital health, about technology, about the digital therapeutics, and of course, the most important word is artificial intelligence and its impact in healthcare. Your thoughts, Dipu?
I mean, first of all, wow, it's been a year, and we've built this community of amazing individuals, and I'm immensely proud to have partnered with you when we were I remember scribbling it down on a notebook when you and I first met and talked about creating this community. And here we are 2,000 plus strong and hopefully growing. And I'd love to see this community grow and have really an international presence. And I think part of that is the fact that we have not only educated our audience through this podcast that we've started, which is now over a year old, but also that we're hosting a global summit on this very particular topic. And we have a lineup that I think any conference would be envious of having in terms of speakers. Do you want to highlight some of our keynotes and speakers?
Yeah, of course. I think the summit is going to be really a big attraction for healthcare providers of all domains and of all age groups, if I can put it, because we have content for everyone, whether it's a medical student, whether it's a flamboyant practicing clinician, whether it's a senior clinician who's really trying to catch up with the basics and the foundations of AI. And of course, with our allied healthcare professionals. So we have something for everybody. It's going to be a 2-day of action-packed summit with keynotes, with plenary sessions, and very, very exciting panel discussions. And I'm sure a lot of these questions on ethics and data security and data privacy are going to come up in hot topics during the panel discussions and the debates that we will be having at the Doctors AI Global Summit. And also, I must tell all our viewers that besides the standard sessions that we will be having, we are also going to be having a fantastic number of representation from research presenters. And this is a part that has really touched me through the last 3 months of preparation, that we have a good number of doctors and healthcare providers, people working in the industry, who have submitted their own research work as an abstract to the summit, and we will be giving out an opportunity to some of the best of them to present their research through an oral presentation during the summit. So I think that is also something to be really looked out for. But of course, you spoke about the keynotes. We're going to have some fantastic keynote sessions. I think most of our folks remember Dr. William Brinson Wicks. He was he's Microsoft Director AI for Health. So he's coming with a keynote. Dr. Peter Swartz, who's the IDF president, he's coming with a keynote. And Dr. Shashank Joshi is a Padma Shri here in India. He's a stalwart in digital health technology. He's coming with a keynote. And there are many more like them who's going to be coming in with keynotes. But what will really, I think, take away the show is going to be the panel discussions, the interdisciplinary discussions that is going to happen, where you have the healthcare providers at one side and the industry experts and the entrepreneurs on the other side, and bring everybody on the same side of the table and have an open discussion. And I think at the end of the day, literacy is going to be the winner, because at the end of the 2 days, all our participants are going to come up with a great deal of knowledge on AI and how it's impacting healthcare. And the other part I wanted to highlight about the summit, and you and me and some of us have been working very hard on preparing the agenda, is that we will be having a very, very comprehensive agenda. So we will try to cover all the aspects of healthcare that comes under the compass of artificial intelligence, with, of course, a whole session dedicated to AI and the digital health ecosystem. So this is going to be there as well. So your book is going to definitely be a topic of discussion: digital health, telemedicine.
That's right. Everyone buy the book before the summit, so you're well prepared. And literally.
Yes, so you get well prepared for that. So on this context, Dipu, you really want to tell them a little bit of a hint where they can really find this book, where they can download it? What's this? Please?
Absolutely. So the ebook is available for download now. Our MedSynapse team will put the links in the chat, and will be available on the YouTube video in the comment section. It is also available on Amazon. We will also put that link for you. And if you have a hard time, you can LinkedIn message me, and I will make sure it gets ironed away for you and make sure we can get you a hard copy. The hard copy is being released November 1st. Would make a great Diwali gift for all of our audience who are budding med students and physicians. So I'm really, really excited for this book launch.
Also, what we're going to do is if most of our folks who are our regular viewers, you've also been catching up with our activities in Doctors AI. We have started a Doctors AI Primer in medical colleges in India, and we have hosted 3 such primers, and we are planning to do a couple of more, probably, hopefully, in November if that materializes. So I am definitely going to ask the students, medical students, and the faculties who are attending these primers to definitely get a copy of this book. I think this book is a must read for starters when they're starting with their
That's right.
AI foundation knowledge, their technology foundation knowledge, and their digital health. That curiosity, what is this all about? And, where do I start with? I think this book is a fantastic place for everyone to start off. So as we
Absolutely.
speak, I think Hitvi is going to put the links of the Amazon store and as well as the store with the publisher on the chat box for all of you. And for those of you who are watching through the MedSynapse platform, you will be getting the link on the chat box there. And for those of you who would be watching us later on our YouTube casting, you would also be getting the link there. But please do get a copy of your book. Dipu has put in a lot of work, and I can see a lot of sleepless nights that has gone into editing. I mean, being an editor is the most difficult part when you're publishing a book. Being a writer is an easy task. You give it and you just say, that's it, that's my task is done. That's what I did. But then she took the trouble of editing the content, compiling everything, and then coming up with something which is very, very valuable for people who are starting with the digital health literacy and AI. Once again, a big congratulations, Deepu, and I think
Thank
it's a big
you.
success. It's a Diwali success for all of us back here
That's
in
right.
India, and to you folks there in the US. But it's a big congratulations and heartiest congratulations on behalf of Doctors AI for coming up with this fantastic application.
Thank you. And I really appreciate your support and the support of the Drs AI community and all of the contributors who I cannot name all of them because there's many of them, but this would not have come to fruition if it hadn't been for all of their contributions. And so I'm really, really immensely grateful to the communities and the relationships that I've built. And let's hope to write another one with the Doctors AI community. I'm excited to see what this evolves to the next level, maybe a second edition or a brand new one,
And for those of you who are hearing about Doctors AI for the first time, if you've joined us for the first time, we will float in some links where you could connect with us directly on the LinkedIn group, as well as join our community on WhatsApp that has over 800 members now connected. And we have a host of activities that we conduct once every Thursday every Thursdays of the week. So we have the update hours, we have the journal club, we have a webinar which is called the Med AI Web Hour, and of course we have our podcast that has been going on for quite a while now. And the big summit is coming up, so we will share out the links to all of you who have not yet registered for the summit. A quick note to all our viewers that the summit regular registration charges will be there till the 31st of October. So I would request all of you who have not yet registered for the summit to quickly go onto the MedSynapse platform, search out for the Global Summit, and you could quickly register for the summit before the registration charges go up. We can all promise you that this summit is going to kind of bring in a new revolution to the way in which we see, we perceive, and we practice medicine. Absolutely. All that we have been really thinking that it's the future, it's going to come someday. I think
it's here.
This summit is going to show you that it's here. It's here to stay. And it's here to stay in a very, very big and a very, very strong way. And it's coming for me, so I better get prepared. So,
exactly. Likewise.
Yes, I think it's a must attend, whether you're a medical student, whether you're a doctor in practice, whether you're somebody who feels I'm beyond the digital age, I'm done with my practice. No, you're not done. You're just getting started. And that's the fun of AI literacy and AI tech literacy. And I feel that we get people curious from all age groups. And that's is so fascinating because learning has no age bar. And we're learning each day as our artificial intelligence's counterpart is also learning each day from our intelligence.
And human plus AI. This is the future of medicine. And I think
Yes,
we definitely
augmented
need to embrace it. Yes.
intelligence.
Augmented intelligence. Absolutely.
Yes.
Absolutely.
And that is probably where someday we can walk down those pages of Deepu's book and we can say that with the help of tech, with the help of AI, we really have been able to extract the intelligence out of the data, give
Yeah.
precision care to that individual in that corner of the world who needed that care at the right point with the most of urgency. And then probably we can say that, yes, we have reached somewhere equitable, accessible healthcare for all.
That's right.
Although it sounds more very much, I mean, kind of an utopic thought at the moment, utopian thought at the moment, but I'm sure that we are going to be reaching that day very soon if we are all geared up towards this digital health and AI tech literacy.
Absolutely. Thank you, Amit.
So once again, dear folks, thank you very much for joining us today. This was a special episode, the book release episode of Digital Health, Telemedicine, and Beyond. In brackets, there is a AI that is not mentioned, but for that you need to read the book. Get the link from the chat box, download the book and read it. But thank you very much to all our viewers who have been supporting our podcast across all the countries, across the globe, who have been regular viewers. We get a lot of people viewing us from the Middle East, from India, of course, from Southeast Asia, Asia Pacific region, as well as from the US. So a big thank you to all our viewers out there for being there with us, supporting the effort that we are doing, and kind of strengthening our literacy with your support and your curious attitude towards this whole topic. Once again, a big thank you for joining us. Dipu, your final words, and then we'll hand over to Hindi.
My final words are our next episode will drop in November 11th, where we will be joined by David Hall and one other guest to talk about pharma and AI and how it's impacting that space in the clinical trials space. So be sure to join us. And until then, I wish everyone a very happy Diwali and a beginning to your holiday season.
Yes, a very happy Diwali, everyone. And back to Hithvi.
Hello. So, firstly, a big congratulations to Dr. Dipu on your release, and I have posted the links on the chat box, so please do have a look. And as well as I have posted the link for the registration of AI Summit as well. So please register, guys, and it's going to be a good summit. So please, and thank you, Dr. Dipu and Dr. Amit, for sharing your journey and insights from the book and your entire journey, Dr. Amit, as well. So thank you so much for adding value to these conversations. And thank you to our audience for joining us for this episode of MedAI series. And we will see you in the next episode, as Deepu mentioned. So until next time, stay curious, stay informed, and keep pushing the boundaries of what is possible in healthcare with AI. Thank you, everybody.
Fantastic. That's a beautiful tagline. Bye bye, everyone. Good night.